Hello everyone, and welcome to our webinar on Explore Health and Social Care at Derby. The webinar will be presented by Helen Morgan and Carl Bridges. If you have any questions, please add them to the Q&A chat and we'll answer them at the end of the webinar. I'll now pass on to you, Helen, to introduce yourself.
Hi everyone, my name is Helen Morgan, so I'm Programme Lead for the Health and Social Care degree at Derby. We're excited to be able to present this webinar to you. So we're going to look at generally the university awards and the course rankings, talk to you about some of the highlights of the course, look at who will teach you, what you'll cover, how you'll learn, the course modules, talk to you about placements, and then look at where the degree will take you after graduation. So we're really excited tonight to be able to tell you about our new degree programme, which will be starting in September. So this is a Bachelor of Science with honours in Health and Social Care Practice. So this will be the first time that the course will be running. It's right up to date, and we're really excited to be able to present this to you. So at the university then, we've got lots of awards. So we're top 20 for teaching quality, top 20 in the UK for overall student satisfaction. 96% of our UK graduates are in employment or further study. And our halls were voted the best university housing and best environmental management in 2023. And within the university then there's lots of the academic staff carrying out innovative research that's having a real impact worldwide. So a couple of those that I'd just like to expand on a little bit further. So we're in the top 10 for student satisfaction in health studies. So obviously the BSc in Health and Social Care Practice sits within that. And we're also top 5 for satisfaction with teaching in social work. As I say, we're really proud of these, and our students, it just shows that our students really enjoy being on the course and get a lot out of it. So this new degree that I was telling you about is a full-time 3-year course based at the Kedleston Road campus in Derby. So to get onto the programme, we look for our students having 96 UCAS points, which is equivalent to A-levels, a BBB or a BCC. If you're studying for T-levels, then we ask for a merit, or a BTEC, then a DMM. And we ask for all our students to have an English grade C or an equivalent qualification. So that can be a functional skills qualification in English as well. The course can be studied with a foundation year. So if you haven't got the requirements, then you can do that foundation year to get you started on the programme. I think it's important to point out that we welcome applications from candidates who have perhaps been working in the field of health and social care for a little while. So mature students over the age of 21, if you're working at level 3 or above and you've got lots of experience, then all that we ask is you're able to evidence that experience to us, and you've got that level 2 functional skills English, or indeed the English GCSE. So the degree is perfect for students who want to follow their passions for working with people, but might not decide what they want that to actually look like. So some of our students go off to do masters in nursing, in social work, occupational therapy, radiography, teaching, policing. So it opens up lots of opportunities for postgraduate study within the field, as well as going on to get a job within the industry.
Hello everyone, my name's Carl Bridges. I'm one of the lecturers on the Health and Social Care programme, and I'm a counsellor by background, and I'm going to talk to you about some of the best bits of the programme. So one of the real strengths of this course is that it prepares you for a career where you're not just supporting services, but you're actively planning and shaping provision for the future. Helen's talked about this being a somewhat new program for us, and updated because the sector is just changing so rapidly. We're seeing increasing complexity, long-term conditions, workforce challenges, and different policy reforms. So you coming out of this as an adaptable, skilled graduate is important. You're not going to learn theory just in isolation. You're going to have the opportunity to put that into practice through placements in a range of settings, from care homes and community projects to local authority teams and third sector organisations. That practical experience will build your confidence and help you understand how services actually operate on the ground. So this course, it's been designed in partnership with professionals and sector experts. So what you're studying always reflects current priorities, whether that's safeguarding, inequality, integrated care, or leadership. We draw on those strong professional links, meaning you'll benefit from seeing other people throughout the industry. And most importantly, you'll be supported by experienced and approachable staff who understand the realities of practice. And you'll have the flexibility to tailor parts of your study towards whatever your interests and career goals are. But we'll talk more about the staff a little bit later. Go to the next slide. So across the university, we have lots of facilities designed to help bridge the gap between classroom learning and real world practice. That's something we feel very strongly about focusing on industry at the University of Derby. They're not just spaces that you go and sit in, they're environments where you can simulate practice, build confidence while going on placement, and then into actual practice. The screenshot you can see on at the moment is our specialist forensic training house that allows students to explore safeguarding, risk assessment, and environmental factors within a realistic scenario. So that's really useful when thinking about elements like vulnerability, abuse, or multi-agency working. So it'll help you apply theory to practice in a safe and supported environment. So by the time you go on placement, you're not just encountering the concept of going into a property for the first time, you've explored it in an applied, interactive way. Then next slide, please.
Okay, so here we've got a picture of the academic staff. So you can see we're all at graduation here in our various robes. A really special day for us when we celebrate our students' successes. And we're proud to meet your family and friends and see you walk across the stage as part of that graduation. So our academic team, so Cole's already said that he's a counsellor by background. I'm an adult nurse by background, so I worked in critical care. We've also got Sarah, who's a social worker by background, and Rachel, who's a qualified youth worker by background. So many of us are still involved in that professional practice, and we're able to bring that to the course to support you with our knowledge and our experience of doing that. So while you're on the programme, you'll have a personal academic tutor who will guide you through your academic progress and help you with their experience and to meet your ambitions and aims while you're on the programme.
And so for what you can cover, we aim to give you a balanced education, academic, practical and vocational. That means you'll be understanding theory but also knowing how to apply it ethically and professionally. You'll explore contemporary issues like inequality, safeguarding, and public health and long-term conditions. We really focus on this programme on forward-thinking practice, and which just encourages you to consider how services need to adapt in response to social, economic, and demographic change. There's a strong emphasis on interprofessional learning, understanding how nurses, social workers, housing officers, youth workers, and others collaborate. You'll also engage with research-based teaching, meaning your learning is informed by evidence and practice-based teaching that links directly into real-world scenarios. So we want your learning to be stimulating, challenging, and enjoyable, and not passive. It's really important in social care because it's about doing. Next slide, please. The learning here is active. You will have lectures and seminars, but we also use debates, demonstrations, role play, and problem-based learning activities. So you might analyse a case study within a session, participate in a mock safeguarding meeting, might observe practice scenarios, or conduct small-scale research tasks. There's online learning to support flexibility and peer tutoring opportunities that build your confidence and skills, especially around things such as leadership. Group work is part of it. It's important because collaboration is central to the sector, and independent research helps you develop your analytical thinking and academic confidence. So by the time you graduate, you won't just know about health and social care, you'll have practiced thinking and working like a professional and actually gone out and done it on placement. Next slide, please.
Okay, so I'm going to move on to talk to you a little bit about some of the modules and some of the topics that you'll cover while you're on programme. So the foundation year, as I said earlier, is for those students who are coming to us who perhaps aren't meeting the requirements to get onto the 3-year degree. So you'll spend a year doing some foundation year modules and getting you ready to come and join the 3-year programme. So as you can see, some of those things are communication skills, preparing you for professional practice, but also offering you the opportunity, if you haven't got that English level 2 or maths, then offering you the opportunity to be able to do that. So the 3-year programme, the year 1 modules, again, I'm not going to read all these out to you, but just some of the highlights. The first module that you'll do is called Foundations of Learning. And that module is all about getting you ready to study at level 4. So to study on a degree. Also a social inequalities module, which gives you the opportunity to explore some of the social inequalities that are in society today, as well as psychology and sociology. So all our students will do those core modules in year 1. At the end of year 1, you'll then work with your personal academic tutor to decide if you're going to stay on the health and social care pathway, or indeed if you'd like to do a pathway in public health or a pathway looking at children and families. So you'll have that opportunity to be able to then go off and choose which pathway you're going to stay on for your degree. But there'll be full support to help you make that decision. So on the general pathway, there's 2 safeguarding modules you can see there, adults and children, getting you ready to go out on professional practice, and then looking at some research in health and social care, which we've both alluded to is a very changing world. If you choose to do the public health pathway, then again, you'll get the opportunity to go out on placement, but then obviously focusing down, so looking at public health and health promotion, and looking at public health and contagious diseases, as well again exploring the research that's happening in the world of health and social care. If you choose the child and family pathway, again that includes a placement and the public health module, but also thinking about safeguarding children and creative approaches with children and family. So the year 3 modules on the core programme. So in year 3, whichever pathway you choose, you get to do a second placement. And at this point, I think it's fair to point out that we are the only health and social care degree that offers 2 placements. So 1 in year 2 and 1 in year 3. Also, a dissertation is part of this year, part of your 3rd year. And then the opportunity to choose some optional modules. So hopefully by this point, you're sort of thinking what you'd like to do after graduation. And you can see there's a suite there of optional modules that you can choose from. And we'll guide you and support you as to which would match your career progression at this point. Exactly the same for public health. So another placement module, an independent study, and then 2 modules there, managing services and global and environmental public health. And for child and family, again, the independent study, the placement, and then 2 very child focused modules for you to study to give you that pathway on your degree qualification. So I'd like to move on just to talk to you very briefly about placements. As I've already said, we are very proud of the fact that we've got 2 placements on our programme, and we work really hard with health and social care, the health and social care industry across Derby, Nottingham, Leicestershire to organise these placements. And it really is an exciting opportunity for you to apply that knowledge in a real world environment. We're looking at you making a positive impact on real people. Also gives you a chance to explore your career options and network with employers. And you'll receive support from our dedicated placements team. So there's the staff you'll fill in an application form for your placement, and we organise those placements for you, meeting the criteria that you've put on that form. So it really is a great opportunity for you to experience the world of health and social care. So whether or not you've come from school or college, or you've worked in health and social care for many years, that gives you the opportunity to try something new. So on this slide is just a few comments that our students sort of have said to us. So Phil, it gave her more confidence and to try something new. Hannah, again, helped her build a confidence and assertiveness working with adolescents with learning disabilities and needs. Charisse, she was honest enough to say that she overcame some of her personal bias and discriminations that she didn't know that she had. And from Kate, it allowed her to build up her resilience around her own development. So our students really do enjoy going out on those placements and gain an awful lot from it.
So I'm going to now talk about some of the graduate outcomes and career opportunities that you have on this program. So next slide, please. So graduates from Health and Social Care program, they move into a wide range of roles, which we've already alluded to. Many work within the local authorities, the NHS, or multi-agency teams. You can be supporting children, young people, or adults. You could work in homelessness and housing services, refugee and asylum seeker support, advocacy and appropriate adult roles, health promotion, community mental health teams, or family support teams. Others can progress into residential care management, commissioning teams, care coordination, or service development roles. So you can see from this that the degree gives you a broad foundation. You're not restricted to one pathway. You develop transferable skills that allow you to move across sector and respond to emerging needs within the communities from that practice experience you get from us. Next slide, please. So throughout the course, you're going to be developing professional skills that employers are actively seeking. And we want to support you with what you do with that. Whether those skills are communication, collaboration, critical thinking, presentation, and so on. We provide bespoke career sessions covering CV development, applications, and interview techniques, and you'll learn professional networking skills throughout the program. And it's not something we leave to the final year. It's going to be something you running across your degree and something you'll see in your assessments and in the teaching sessions. As well, our Careers Employment Service will support you from day one, and that continues after graduation. So even after you leave, you will still have access to advice, guidance, and support as you establish your career. They even offer a service where you can borrow a suit for an interview if you need it. Let's next slide, please. So further study, many of our graduates will choose to progress into further professional training. The degree provides a very strong foundation for routes such as nursing, that can be adult, pediatric, or mental health, occupational therapy, radiography, social work, youth work, teaching and counselling. We have some students move into policing, environmental health, or many other postgraduate study opportunities. You will work with your personal academic tutor over the time you're on the program to figure out what's best for you, and we'll support you in making that path work. So some continue into regulated professions and others go into more regular practice. So the key point here is flexibility. You're building academic confidence, sector understanding, and professional values that support multiple career directions. So if you are looking for a course that just opens those doors for you, gives you options, and prepares you to make meaningful differences in the communities that you live in, we absolutely would love to welcome you to the university. Thank you.
Okay, so if you've got any questions or you'd like to come along to the university and have a look round, then Carl and I would welcome an email from you, so you can see both our email addresses are up there, and also check out the university website for any upcoming open days and book yourself on, come along and say hello, and we'll be able to answer any further questions. If you'd like to bring your family or your friends to have a look as well, then that's a great opportunity for you to be able to do that. Okay,
Great.
so thank you for joining us.
Thank you very much, everyone.
Thank you both. That was a really great webinar, really informative. We've had a couple of questions this evening, and the first one is, I am a wheelchair user. How do you accommodate for this?
So our lecture spaces and the university is accessible. So from coming in onto the campus and getting around, we do make it accessible. You will be able to access student services to develop a support plan. So we have it down on paper how we can best support you. We are all professionals within the sector, so I'd like to think that speaks to how we are inclusive in our practice, and that includes in our teaching environment. So whatever your individual needs are, just come and talk to us and come to one of the open days and see if the campus suits you.
Super, thanks, Carl. Just the last question for this evening. I know you've touched on placements, but the question was, will there be options for work placements?
Yeah, so I'm happy to answer that question. So we've got a large portfolio of placements, ranging from nurseries to schools, to special educational needs schools, through to working with adolescents, older adults, people with learning disabilities, right to end of life care, and that's using charities, local authorities. We have got a wide range of placements that are available that hopefully we could tailor make to meet people's individual needs.
Super, thanks, Helen. That's all the questions that we have this evening. So I'll hand back to you, Helen, just to say a final goodbye for the evening.
Okay, well, thanks everyone for joining us. Hope you found that useful, and please don't hesitate to get in touch if you've got any questions. We'd love to welcome you onto the programme. Thanks for your time.
Take care, everyone.